The primary objective of adjustment is accomplished by the selective grinding of tooth surfaces that cause stressful contacts and interfere with jaw function. This series of videos will introduce basic terminology related to occlusal adjustment, types of interferences and how these adjustments are performed. The process of equilibration will be carried out in a sequential manner.
Centric relation is a maxillomandibular relationship. The position has been difficult to define anatomically, but is determined clinically by assessing when the jaw can hinge on a fixed terminal axis, up to 25 mm.
It is considered a reliable and reproducible reference point at which the mandible behaves as a pure hinge, and is independent of tooth contact.
Maximal intercuspal position, or MIP, is the complete intercuspation of teeth independent of condylar position, sometimes referred to as best fit of the teeth.
In general, MIP is located anterior to centric relation. Here, the mandible no longer functions as a hinge, but assumes an anterolateral position as the teeth interdigitate.
Premature contact is tooth contact occurring before a stable jaw-to-jaw relationship is attained.
Also known as a deflective occlusal contact, it is any contact that diverts the mandible from its intended movement or displaces a denture from its basal seat.
Supporting cusps or holding cusps are the lingual cusps of maxillary posterior teeth and the buccal cusps of mandibular posterior teeth.
Also included as a supporting cusp are the incised ledges of mandibular anterior teeth. Centric stops, centric holding contacts. These are the opposing cusp fossa contacts that maintain the occlusal vertical dimension between the opposing arches.
One of the basic principles of occlusal adjustment is to establish an even distribution of stops over the teeth, and to shape and locate the stops, so that the forces are directed as nearly parallel as possible down the long axis of both upper and lower teeth. To prevent unwanted movement of teeth, contact areas of supporting or holding cusps should never be left on unbalanced slanting inclines.
Contact areas should be either on a flat surface perpendicular to the long axis of the tooth or on opposing balanced inclines.
Working side movement. This is also known as lateral. Working side occlusion refers to the occlusal relationship of the teeth on the side of the rotating condyle. This movement is away from the tongue.
Non-working side movement is called mediotrusion. It is movement toward the tongue and on the side of the orbiting condyle. Non-working side contacts are often the cause of traumatic occlusion and should be removed whenever possible. Protrusive excursions. The path of the mandibular teeth as the mandible leaves centric and moves protrusively. Ideally, only the anterior teeth should touch in protrusive excursions.
Variation and distribution of lateral stresses. There are several variations of lateral stress distributions. In group function, the distribution of lateral forces includes teeth on the working side.
Here the distribution of lateral forces to selective teeth while others contact only in centric, or MIP, permits exclusion of weak hypermobile teeth from lateral stresses.
Cuspid protected occlusion. Lateral stresses are borne primarily by the cuspids.
Mutually protected occlusion. In this philosophy of occlusion, the posterior teeth protect the anterior teeth enclosure, while anterior teeth act to protect posterior teeth in eccentric motion. In natural occlusion, there should be no contact between posterior teeth as the mandible protrudes. Occlusal adjustment refers to the selective grinding of tooth surfaces to eliminate stressful tooth contacts which interfere with normal jaw function. The process is subtractive and irreversible. A number of situations exist where adjustment is contraindicated.
In the next video we will discuss types of interferences and a few basic guidelines for adjustment. Due to variations in individual patients, it is impossible to provide guidelines which are equally applicable to all patients.